Hey everyone, welcome. Today we're tackling a massive topic for your exams and your entire nursing career, communication. And let's be real, it's not just about being nice to people. It's a critical clinical skill, and getting it right can literally save a life, while getting it wrong can be catastrophic. So, we're going to break down the entire blueprint for therapeutic communication, helping you crush your exams and, more importantly, become a safer, more effective nurse.
So here's our game plan. We're going to build this from the ground up, starting with the absolute basics of how a message works. Then we'll build the formal nurse-patient relationship, fill up your toolbox with what to say and what not to say, cover how to adapt to special needs, and wrap it all up with those super high-stakes moments, like patient handoffs.
All right, let's dive in. Before we can even think about having a therapeutic conversation, we have to understand the basic mechanics. How does a message even get from one person to another? So let's map out the fundamental model that's behind every single interaction you're going to have.
Every single conversation starts right here with something called a referent. Just think of it as the spark, the motivator. A patient suddenly feels crushing chest pain. That pain is the referent. It's the whole reason they're motivated to form a message and hit that call bell to get you. You see, communication isn't a straight line. It's this constant circular loop. But look at all the places it can go wrong. The patient's anxiety, a crazy noisy hallway, even your own stress. A breakdown in any one of these pieces can and does lead to serious medical errors.
Okay, this slide right here is a golden rule. I mean it. For your exams, for your entire career. A patient might look you in the eye and say, "I'm fine," but their fists are clenched and they're stiff as a board. When the words and the body language don't match, you believe the body language every single time. That's where the truth is.
Let's put that to the test. So, what do you do here? The mouth says yes, but the body is screaming no. The correct action, and what the NCLEX is looking for, is to stop everything and gently call it out. You have to validate that nonverbal behavior. You might say something like, "I noticed you're looking out the window. Did I catch you at a bad time?" You have to investigate that disconnect.
Okay, now let's build on that. We're going to take those basic communication pieces and start constructing the formal, professional relationship that you need to have with every single one of your patients. Now, for your exams, this is critical. The nurse-patient relationship isn't a friendship. It's a professional procedure with 4 very distinct phases. You have to know what happens in each one, in order. It has a definite beginning, a middle, and a planned-for end.
So quick gut check. You haven't even met the patient yet, right? You're at the computer, doing your homework, looking at their chart, getting ready. That's it. That's the pre-interaction phase. You're preparing to provide safe care before you even lay eyes on them.
And this is how you show a patient they have your full attention. Active listening is not a passive sport. Your body language sends a powerful message. This little acronym, SURETY, is a great guide. It shows your patient non-verbally, "I am here with you, and right now, you are the only person in my world."
Okay, foundation is set. Now it's time to stock your toolbox with some actual techniques. We're going to talk about the green lights, the things that encourage a patient to talk, and the red lights that just shut a conversation down cold.
Listen up, because this is huge. Memorize these blockers. If you see an answer choice on an exam that asks why, gives false reassurance, or offers a personal opinion, it is almost 100% the wrong answer. These are communication killers. They put up walls, and our job is to take them down.
This table shows you exactly how to translate from a blocker to a facilitator. Instead of just shutting them down with, "You'll be fine," you open a door by reflecting their feeling. It sounds like you're feeling a lot of fear. You're not slamming doors in their face, you're inviting them to walk through.
So, what's our goal here? It's not to argue or convince, it's to understand. The best response is the one that validates their feeling without judgment. Something like, "It sounds like you're feeling hopeless about the treatment plan." See? You're not agreeing, you're not disagreeing. You're just holding up a mirror to what they're feeling, and that makes them feel heard. Of course, communication is not one size fits all, and a communication breakdown because of a language barrier or a hearing impairment isn't just an inconvenience, it's a massive patient safety issue. So let's talk about the key adaptations you have to make.
Okay, warning. This is a classic NCLEX trap question. The daughter offers to translate, and it seems so nice and helpful, right? No, it is dangerous and it's against policy. Family members can filter, they can misinterpret medical terms. It's just not safe. Your priority action is to politely decline and get a professional, certified interpreter.
no exceptions.
Each of these situations needs a specific approach, but you see the common thread, right? You are changing your approach to open the channel, and I really want to highlight this last one. For the unresponsive patient, you always assume they can hear you. Hearing is believed to be the last sense to go, so talk them through everything you're doing.
All right, let's bring it all home. We're going to talk about the moments where communication is literally life or death. Patient handoffs. We'll cover the tool for that, and then we'll do a rapid-fire recap of the absolute must-knows for your test.
SBAR. This needs to be tattooed on your brain. It's your script for calling a doctor or giving a report. It cuts out all the fluff and gets straight to the point. Situation, background, assessment, recommendation. It organizes your thoughts and makes sure nothing critical gets missed. Practice this until you can do it in your sleep.
And here you go. This is your high-yield, cram-before-the-exam summary. If you remember nothing else, remember these 4 things. SBAR for handoffs. Believe the nonverbal. Never use those blocking techniques, and always use a professional interpreter. Master these 4, and you're going to be in great shape.
Ultimately, this is the whole point. Everything we've talked about, from active listening to SBR, it's all designed to do one thing: keep our patients safe. Communication isn't a soft skill in nursing. It's a primary tool we use to prevent harm. So I'll leave you with this to think about. Now that you have the blueprint, which one of those communication blockers is going to be the toughest for you to stop using in your everyday life? For a lot of us, it's that false reassurance, right? Because mastering this stuff isn't just about passing a test. It's about unlearning our own social habits so we can become the kind of perceptive, safe, and truly effective nurses our patients need us to be.